Let me know when we're ready, Jake. We're good?
You're good.
All right. Good afternoon, everyone. It is a pleasure to see you. We are in week 13 of vaccine administration. I had the opportunity this morning to tour the Baltimore City Convention Center, which was one of the partnership sites, vaccine sites, to see both the field hospital as well as the vaccine administration. I will tell you, people were lined up blocks and blocks and blocks, but everybody was in a good mood. I think everybody was excited to be able to get their vaccine. It was an incredibly efficient system. The line was continuously moving. It's amazing what has been set up in that facility. I just was asking people where they were from. 5 out of 6 were from surrounding counties. 1 out of 6 were city residents. And it was a small sample size, so I want to be fair about that. But that is a dedicated site. Theoretically, as of March 1, I believe, was a site that is for local residents, and then M&T is a larger surrounding area. I think the data continues to bear out. The vaccine hunting is very much still a case, and so people are traveling to wherever they can get the vaccine. The other point I wanted to make, I will tell you, this week I had an increased number of calls about just where to go. So hopefully that's something that we'll focus on. Where do they go? Where do you sign up? How do you know for sure? So with that, let me hand it over to Mr. Powell, and we will jump into the data. Mr. Powell, you are on mute.
Thanks, Mr. President and work group. Jake, if you'd pull that PowerPoint up, I'll go through this as quickly as I can. There we go. So we usually like to start with this, which is that since vaccinations became available in mid-December, number of positive cases daily is down 71%. The positivity rate is down 54%. And the number of tests per day is down about 30%. So seeing some progress. Next slide, please. This is the number of vaccinations given over the time that we've been doing this. That continues. The green line is sort of the average of all doses given over time. That continues to kind of grow at a steady rate. I want to be clear, this does not count the Johnson & Johnson vaccine, which I think about 50,000 doses were made available in Maryland this week. I think as of Saturday, 11,111 had been given, and I think there was around another 8,000 given yesterday. So they are not captured in these numbers. So the actual, as far as number of people, it's going to look a little higher than this once we're able to incorporate those in with this data. Next slide, Jake. Thanks. This is interesting. We've just been tracking the ratio of first doses to second doses just to kind of get a sense of, who's getting first ones, who's getting second ones, and that declined for a long time till, as of a week or so ago, more people were getting second doses than first. That's kind of gone in the other direction recently, which is a sign, I think, that more of the vaccine is going to people who are getting it for the first time. Next slide, please. This is interesting. We've been watching this for a while because public health experts have told us that we should see a decline in the hospitals in deaths, in the death rate. That's greater than the decline in the positivity rate because you're vaccinating the right people. So it's people that are at risk of being hospitalized or dying from COVID that are getting the vaccine as a priority. And maybe for the first time, we're starting to see that. That death rate is the orange line on the graph. The positivity rate is the blue line. It may be a little too early to tell, but if that's the case, I think that's probably a pretty good sign. We'll continue to watch. Next slide, please. This is how Maryland compares to the other 49 states and the District of Columbia. And we are, remain in the middle of the pack, although it's been a pretty good improvement recently. I think we're 27th as far as the percent of our population that's gotten a first dose, and I think 19th in the percent of our population that's gotten a second dose. So again, still in sort of the middle of the pack, but I think if we looked at this a few weeks ago, we were sort of towards a little further to the left and down on there. So that's, I think, a good sign. Next slide, please. This shows the amount of vaccine that we have in our possession that hasn't yet been used, and we sort of smooth that out using some kind of an average. And the best 10 states in the country are represented by that black line at the top that have used the most of what they have. You see everyone in the country sort of had more available but not used as of a week or so ago because there was an increase in allocation from the federal government. Maryland's interesting, kind of showing a positive sign in using what we have compared to the average of the other states and some of the states that aren't using as much as they have. So we'll continue to watch that. Next slide, please. We've shown sort of for all the counties in Maryland and Baltimore City, what percentage of the population are they and what percentage of the vaccine they've gotten. That was it was tough to put 24 counties on a chart, so we split it into two. So this is the 8 largest counties in Maryland. You can see what we've seen for weeks, which is that Prince George's, which has somewhere around 15%, I'm sorry, I can't see it right now, of the state's population has gotten 8 or 9% of first dose vaccines. And you can see where other counties are on that as well. If we can go to the next slide, I'll just show, this is for the other 16 jurisdictions, some of the smaller ones. And I'll point out places like, let me point to Washington and Washington and Allegheny County. They've both received, almost a proportionate amount of first dose vaccines compared to their population. But no, we've also put death rate and COVID case rate on this as well. And they were 2 of the counties that were kind of hardest hit by the COVID pandemic. Next slide, please. Sorry, great. So we wanted to look at, people with the highest rate of vaccination or counties with the highest rates of vaccination. We've looked at it by month. So if you can see like that orange bar there is Prince George's County. It's like the second from the left in each of these groups. So some improvement between January and February, but still sort of behind where some of the other jurisdictions are. Baltimore City actually a little bit of a decline from January to February. And again, still behind some of the other of the 8 largest jurisdictions. Next slide, please. We've shown this for a while, which is just different demographic categories of Marylanders and what percentage of Maryland's population they are and what percentage of first dose vaccines they've gotten. I do want to note, I think, a little bit of improvement in the Black or African American first dose vaccinations. I think as of a few weeks ago, it was around 15%, and most recently up to about 17%. So still disproportionately low compared to how much of Maryland's population they represent, but maybe perhaps inching in the right direction. Next slide, please. This shows that same data broken down by race and ethnicity by month. Just this sort of shows what I mentioned before, which is that between January and February, a slight increase in the rate of vaccination for Black or African American Marylanders. Next slide, please. This is the last one we've got. This is new, and we took a look at the death rate per 10,000 by select races and ethnicities in Maryland. And mostly we wanted to see if that was declining since vaccinations became available in mid-December. That is the case. The rate for Black or African American Marylanders remains unfortunately higher, but is declining at basically the same rate as other races and ethnicities in the state. So I think that's something we're going to continue to pay attention to. That's all I have, Mr. President. Thank you, and I'm available for any questions.
Thank you, Mr. Powell. Appreciate your weekly update. Over to Acting Secretary Schrader. Oh, Mr. Secretary, I think you need to unmute.
Mr. President, can you hear me?
There we go.
Great, thank you. And thank you, President Ferguson. Good afternoon, Senators. And President Ferguson did want to thank you for going over to the Convention Center today. People are working really hard, and the recognition that with people like yourself showing up is good for morale. So thank you for having done that. I want to start today's session by putting into perspective how far we've come since we've administered our first COVID-19 vaccine on December 14th, just 13 weeks ago. Since that day, we've administered nearly 1.6 million vaccines, and our seven-day average is more than 36,000 per day, and in just 1 month, that's jumped 70%. So we're very excited by that data point. And I think, as Mr. Powell noted, and I'll talk more about this later, according to CDC, Maryland is improving across the board on first doses, second doses, and supply used. If I can get the next slide, please. Approximately 50% of the eligible population in Maryland has been vaccinated, and the long-term care program is nearly complete. On Saturday, as you probably read, we reported a new one-day record of 50,000 vaccinations administered. And the exciting part about that is that that tells us we are building capacity with the infrastructure that we've been putting in place. We've now opened 418 vaccination sites across the state, including 4 mass vac sites that are up and running, and 2 more will be up by the end of this month. And our statewide call center, which we have talked about, has now fielded more than 620,000 calls and has helped schedule almost 21,000 appointments. So the data demonstrates under extraordinary circumstances we have achieved tremendous amount since our first vaccination. And the actions of 10,000 strong Maryland Department of Health, our local health departments, our many other state, federal, and private sector partners have really been working tirelessly and has opened a massive theater-scale fight in a race to vaccinate Marylanders. Of course, our work is far from done, and no plan is perfect on first contact, and our ability to rapidly address some of the challenges that we have talked about here over the last several weeks and prepare for significant increases in vaccine doses has been quite remarkable. As you know, last week the governor again expressed his frustration over the fact that there are about 1 million people who are currently eligible for the vaccine who cannot schedule an appointment due to short supply. I share his frustration. I know you share his frustration, and Marylanders across the board share that frustration. If I could get the next slide, please. And as you know, last week on Thursday, we rolled out the plan to address the challenges surrounding vaccine equity in underserved communities across the state. One of the things that we're focused on, we've identified 4 key areas: trust, transportation, technology, and vaccine information as the main barriers to Black, Hispanic, and disabled Marylanders getting vaccinated. We have a plan in place to address the challenges, and General Burkhead is leading its execution. Next slide, please. So last week, I wanted to update the group on an issue we discussed. Mr. Powell touched on it briefly. Our data team has analyzed the CDC data on the vaccine doses flowing into Maryland and found some differences between what the CDC was reporting and was showing up on our state system. The good news is we met last week with White House COVID-19 Data Director, Dr. Cyrus Shapar, who confirmed that 98,000 doses had been sent to Walter Reed and not administered to Marylanders and had been incorrectly attributed to Maryland. The CDC has now removed those doses from our balance sheet. That leaves us about 130,000 doses that have been distributed to federal agencies that have been counted towards our allocation. The federal government confirmed that they have administered about 60,000 of those doses. So we're going to be tracking that very closely. We'll continue to engage the federal government in pushing the administration of these doses, and Dr. Shapar and General Perna have pledged to work with us to identify the lags and increase the throughput at those agencies. But the good news, through the collaboration with the federal government, we now, as was reported, have the 16th highest daily rate of vaccinations in the country. Our supply used is now 30th, and doses per 100,000 is 32nd. So we still have work to do there, of course, but over the last 2 or 3 weeks, we've seen good progress. Next slide, please. I want to touch on a discussion we had last week regarding allocation. It's clear there was a great deal of interest in our method, so I wanted to take a few minutes to walk through how we allocate. As we've committed from day one, we start with allocating vaccines on a pro rata basis by population across all providers in each jurisdiction. When we get our allocation, we dedicate approximately 30% of it to local health departments on a pro rata basis. We then dedicate another 30% to the 4 mass vac sites, and then we distribute the remaining 40% to other, or 30 to 40% to other providers. You can see that, and if you can go to the next slide.
Just, Mr. Secretary, very quickly on this slide before you go. That 30%,
yeah, go right ahead. Go right ahead.
Is that 30% of total population, or is that of eligible population?
Total population.
Okay.
Total population. So if the population is 65,000, that would be the baseline that we would use for the pro rata calculation. Okay? So anyway, on this slide, the left-hand side of this slide is the allocation by county for weeks 1 through 11. And on the right-hand side, it's the more recent weeks 9 through 11. And you can see in the beginning, they roughly track with population around the state. The first few weeks on the left-hand side, however, you see the numbers were off a bit because only healthcare workers, first responders, and nursing homes were eligible at that time in 1A. As we moved through time, now that we've been vaccinating the general public over 65 for several weeks, we have visibility on where people are getting vaccinated through our Immunet system. So we review that data each week and make adjustments to make sure that there's equity for every jurisdiction. So that if the population in one jurisdiction is finding vaccine somewhere else, we're making adjustments based on the Immunet data to make sure that every county is getting a fair allocation. Now, there are always going to be exceptions and adjustments. For example, St. Mary's County, there are fewer providers, and the local health department is the major provider, so we dial them up. They get more with the local health department. On the flip side, Washington County has established a strong partnership with Meritus Hospital, and they've directed doses there, so we've adjusted accordingly. So it's a two-step process. It's a baseline pro rata, and then it's an analysis of where the shots have been given by jurisdiction through Immunet, and then we make adjustments there. So I hope this gives some clarity. We can answer questions on this, but I wanted to just take a minute to ask our MaxVax coordinator, Chaz Eby, to give a brief update on our MaxVax program, but also some of the work that's going on with FEMA, because FEMA's in the state now, and we want to keep you apprised of what we're doing with them. Go ahead, Chaz.
Thank you, Secretary Schrader. And good afternoon, President Ferguson and members of the Vaccine Oversight Workgroup. Again, my name is Chaz Eby. For the record, I work at the Maryland Emergency Management Agency, and I'm here today to discuss our state-led mass vaccination efforts. State-led mass vaccination is a key component that we're using to maximize efficiencies in our statewide vaccination program. We're working daily to build new sites, but we're also working to improve our current sites each day so that we can vaccinate as many Marylanders as quickly and equitably as possible. Next slide. Next slide, please. There we go. This is a photo of the Six Flags site in Prince George's County. That's our first site. They're vaccinating approximately 4,000 people per day now. There are over 50,000 total vaccinations, and actually by the end of today, we'll be approaching 60,000. The next site is the Baltimore Convention Center, which is focusing on hard-to-reach populations and underserved people in the city. Next is M&T Bank Stadium in Baltimore City. This is a photo of M&T Bank Stadium at the vaccination stations. M&T recently surpassed 10,000 total vaccinations We're really excited about M&T Bank Stadium because we believe we can ramp this site up steadily and continue to provide access to vaccinations for many. And the last site, if you want to move to the next slide, is Regency Furniture Stadium in Charles County, which just opened last Thursday, and they're already doing over 2,000 or approximately 2,000 vaccinations per day. We're also planning for additional sites in Western Maryland and the Eastern Shore this month. So if you haven't had the chance to, I would like to briefly walk you through the experience of getting a vaccination at a mass vaccination site.
I think we're okay. I don't think we need a full walkthrough. This is helpful. We see the checklist.
All right, I will not walk you through. One thing I do want to point out, though, Mr. President, is all these components do require really strong partnerships with our local jurisdictions, as well as FEMA, which I'll touch on in a moment. But rather than just, the state go in ourselves, we find the right people to do the right job as effectively as possible. And this helps our throughput, which is really key. We want to move from, 200 to 300 people, maybe even up to 400 people per hour. And so improvement is really key in our mass vaccination sites. So FEMA supported us, as you can see on this slide. We've been very successful in leveraging FEMA dollars as well as technical expertise to bolster our own response. FEMA approved our request into supporting Regency Furniture Stadium and our mass vaccination site there. We've also been successful in having almost $650 million obligated in funding, and this is at the end of February. This number is just going to grow because they're for things like emergency protective measures, like those taken by state agencies, but it also includes local jurisdictions and even hospitals in some cases. And finally, if you move to the last slide, thank you. We're also very interested in finding ways to support our local jurisdictions. We can do that through reimbursement, such as the FEMA Public Assistance Program that I just talked about. But we've also developed and have been utilizing a staffing assistance program. It's the same program we've been using to staff the state sites. We've opened that up, and we're happy to provide that to local jurisdictions as well. And finally, if there is any state equipment or supplies that they're lacking, through our established emergency management process, local jurisdictions can request that as well and work with MEMA so that we can make sure that they're continuing to build sites, improve them, and that we're assisting local jurisdictions in order to get more mass vaccinations into people's arms. So thank you very much for your time. I appreciate it.
Thank you very much.
Thanks, Chaz. Mr. President, thank you. And I just wanted to make one other point that may not be obvious, but a year ago when we got into this in the spring, March and April, the state went into, it wasn't the way the federal government was managing it, but our state went into the incident command system and used MEMA to help us get organized and put that whole that's how that number, that you saw that 649, that was not an accident. That was done intentionally, and now it's paying off that we've been using the incident command system for almost a year, and the numbers bear that out. So I'll stop there, and we'll take questions, sir.
Excellent. Thank you, Mr. Secretary. So there is no doubt things are moving much more quickly, and that is very good for everyone. I had sort of three questions, but I think the first two I'm going to combine because I think they're very similar. And I do appreciate the data from CRISP. The demand continues to outpace supply, which we know to be true. The over 75-year-olds, if you look at jurisdictions with lower wealth, the percentage of those who are over 75 who have not been vaccinated is 20 or 30 percentage points higher than in other jurisdictions. And my general sense, I think Maryland has the highest, the Maryland Vaccine Hunters has the most populated Facebook group in the country. This sense of like the frantic searching for that, where to go. I am really concerned about city in Prince George's 75 to 84-year-olds, 62% have still not been vaccinated. 85-year-olds and above, almost 70% have not been vaccinated. That's a very similar story in Prince George's where it's 55% and 60%. And I think it's the same cohort of people that is struggling to use the sign-up system. So can you tell us about this pre-registration system and how it will function with these multiple streams of delivery?
Well, so the pre-registration system is coming together very nicely, and we plan to roll it out in mid-March. So we'll be talking about that soon. I did want to make a couple of observations, though. When, because of equity, one of the things we learned is that, the 75 and older tends to be more dominated by Caucasians. And in order to get equity, we moved to 65 plus. We are now leading the nation, and we've vaccinated almost 47% plus of our 65 and older. So although we are focused definitely on 75 plus, we moved to that 65 plus, and from an equity perspective, I think it's an important thing, although it did add more people, and it made it a little more harder for us, but we felt it was worth it because of that. And when we get to the pre-registration system for all of our mass vac sites, it'll handle mass vax, and it will also provide, in conjunction with, we've got the phone system now that's up and running for people who are not computer users. So it gives people options. They can call on 855-MD-GO-VAX. They can use our website, and then they'll be able to use the pre-registration. So there will be options, and that's coming very soon. We'll be talking about that in the next week or two.
And when that's up and running, that'll just be the mass vac sites. That will not be the CVS's, the Giants, the Rite Aids of the world. Is that right?
It will. For that, yes, but we are also working with the local jurisdictions to get from their lists and feed it into the pre-reg. So we want to provide support to the local jurisdictions that are interested in working with us on that. So all of that is being pulled together as we speak.
Okay, I really look forward to hearing more about that. I mean, I think this is a fundamental challenge in the system, is just where to go and what list to be on at what time. I do just very briefly on Johnson & Johnson. Do you plan on reporting it differently because it's a single dose? Or do you have a rollout for how to track the use of Johnson & Johnson?
Yes, Mr. President, we've been talking with the federal government because we wanted to make sure we were aligned with their thinking, and they're going to create a category called fully vaccinated so that there's no confusion between first and second doses. We're working on that as we speak with our system. Right now, last week, as we reported, we got 49,600 doses, and we've used about 19,000 so far. So we'll be moving through that fairly quickly, as was noted by Mr. Powell in the numbers.
Great. Well, I want to make sure our members have time. We have our order today. We're going to start with Senator Rosapep, and now I can't find my sheet, and there it is. Senator Rosapep, then Senator Eckert, Senator Young, Washington, Lamb. So we'll jump to Senator Rosapep.
Thank you very much, Mr. President. I had the opportunity this morning, to visit Six Flags in Prince George's. And I can tell you there are more than enough Prince Georgians of all kinds of ethnic backgrounds who are there wanting to get vaccines. So it's not a shortage of people in Prince George's wanting to get vaccinated. What I did notice, though, in the data is that Prince George's still remains at the absolute bottom of the list in terms of the percentage of folks who've gotten vaccinated. It's gone up compared to what was last week, but in relative terms, it's gone up more elsewhere in the state. Problem getting people vaccinated in Prince George. It's not a lack of interest by Prince Georgians. The county has a waiting list of, I think, 125,000 people. So it's not the Prince Georgians don't want to get vaccinated. What is the problem?
Well, it goes back to what we were saying earlier, trust, transportation, and
trust. Time out. Trust. People want to get vaccinated. They're not trusting vaccinations. They want to get vaccinated.
Right. So the two key for us in Prince George's are transportation and technology. And one of the things we're doing is we are working with the local health department, asking them for people. We've guaranteed a number of appointment slots that we use with our call center, and we guarantee that those slots will go to Prince George's residents.
Thank you. What percentage of the slots at Six Flags are now guaranteed for Prince Georgians?
I'd have to get I don't have that percentage in front of me.
Would you do that?
We can get that for you, yeah. I know I'm told we're doing about 500 a week, but let me get the actual data.
I would really appreciate it.
Yeah, we'll write that down and get back to you on that.
Thank you very, very much. As you know, the Biden administration is growing the availability of vaccines. And of course, the president's going to be here, I guess, on Wednesday, visiting Maryland. What are the projections you have now for the number of doses from whatever of the three vaccines that we will get next week, the week after, number one? Number two, have we got estimates yet for the federal government of vaccines coming to Maryland, to the federal agencies, directly to the pharmacies, not through the state system? Do we have the numbers for the next week or two?
Yeah, let me see if I can parse that in pieces. So we have been told, and we don't expect to get much Johnson & Johnson for the next 2,
right,
maybe 3 weeks. However, when we get into early first week April, we're expecting a large distribution. I don't want to speculate on the numbers, but it's going to be a very nice bump up, similar to what we saw last week. So that's what we're planning for. And then your second question, I'm sorry.
What are we planning for this week and next week from the federal government?
Yeah, so we're expecting a small amount, but we haven't actually. We don't get the numbers until Tuesday. So we'll know tomorrow afternoon about 6 o'clock whether we're going to get some.
What was the number you got last Tuesday? Let's try that.
Last Tuesday we didn't get any. We got the 49,600 on Sunday, and then 0 on Tuesday. This is for Johnson & Johnson now.
No, I'm talking about everything. I'm talking about all.
Everything. We're actually seeing a bump up in Pfizer, so it's probably around 128,000. So we're seeing a nice uptick.
So for like this week, it should be something like 128,000.
That's what we're expecting. Yes.
Okay. Thank you very much. Thank you, Mr. President.
And that's total doses, including first dose, or that's total doses?
That's first doses. Usually when I'm quoting doses, I just quote first doses because we know the second will come behind it. Yeah.
Perfect. Thank you. Senator Eckert.
Thank you very much. Thank you all for your continued vigilance. I appreciate the effort. It's still a problem with getting vaccines. Same thing everybody else has been saying. I did have a question. Are you just giving the Johnson & Johnson vaccine to the jurisdictions? Is there any criteria for triage or targeting to certain populations moving forward, or is it just letting the jurisdictions make those decisions? Thank you.
Thank you, Madam Senator. First off, we have been advised by the federal government not to target those doses to any particular population, and we are spreading them across the state. So we're using them for the mass vac sites. We're giving some to local health departments. We're giving some to hospitals. We want to see how that goes, but we're spreading them around in accordance with the guidance we've gotten from the federal government.
So no respecter of age group, criteria, or whatever?
No, we've been advised not to do that.
Okay. So it's up to those jurisdictions who they're going to give it out to on their list. Right.
So one thing I will mention, obviously, you have to be in phase 1 to get one of those doses for now that we're in phase 1. But there are also what I would call use cases that are being developed. So, for example, if you're in a hospital and you've just had, a hospital stay, and then you're going to be discharged back to a nursing home, and you haven't been vaccinated, Johnson & Johnson is perfect for that use case, because this way we don't have to worry about the second dose. we're developing other use cases that target clinical issues, but as far as population and
Right.
demographics,
Yeah,
we're
that's-
not.
No, I was looking at any criteria, and that would be the clinical concerns. So you've answered my question. Thank you very much. Thank you, Mr. President.
Thank you, Senator. And just curiosity, what is the recommendation for why is the federal government saying not Johnson & Johnson? Why not target Johnson & Johnson?
There's a concern, I believe. It wasn't, let's put it this way, it wasn't said overtly. It was just advised to us not to do that. I think there might be some concern about how it might be perceived if you're targeting to one community or another. So we've been very careful to honor that request. I really can't say that I know the specific rationale, but we didn't ask a lot of questions on that regard.
Thank you. Senator Young?
Thank you, Mr. President. I have about 4 or 5 questions, but hopefully the first couple you can answer in a word or two. I'm not for long explanations, but is everyone that's needing a second dose getting it? Are the second doses available to the people who've had the first one?
Yes, yeah, no
Okay.
question.
Thanks. I noticed on one of the charts that females are getting them a lot faster than males are. Do you know is there a reason for that you're aware of?
I've asked that question. We have not gotten to the bottom of that, but I've also noticed that myself, yes.
Okay. I'll just, we'll go to one more short one then. You told me on one of the previous ones that the feds were deciding what drugstores or what drug companies were getting, that you all weren't doing that. Are they generally coordinating with you, and are you generally coordinating with the local governments?
So we have brought that to the attention of General Perna and the federal government, and they have agreed. Heretofore, there's a system called Tiberius, without getting into the weeds, that they use for planning, and we have asked to start to see where they're directing these doses, and they have agreed that sometime this week or next, they will start to put that into Tiberius. Once that happens, we'll hopefully have more visibility, but right now we don't. What we do see, and you'll see it in your daily reports, by the way, you'll probably notice, like in the long-term care numbers, you'll see it's, let's see, what was it today, 149%. The reason for that is CVS and Walgreens are getting doses that they're from the federal government, and they're giving them out. So they are going to the pharmacies, but we don't yet have the kind of visibility that we would like to have.
Okay.
But we will.
On the mass sites, are you allocating those doses to the county where the mass site is, or are you breaking it down and transferring them back to where the people, what county the people are from that are getting them?
So let me break that into 2 pieces. So on the allocation side, we do not charge that allocation against the county. So if you're in Prince George's County, those allocations are not against Prince George's County. What we do at the back end, though, with Immunet is we go in, and because we know the addresses, the residents of the individuals, we then double check and we compare statewide. So that's the process that we go through.
Okay, last question. President Biden said by the end of May, there will be vaccines for anybody that wants them. Are you getting enough sites set up, minor mass sites in all the counties that by the time those vaccines are available, that we can put them right straight into arms? For example, if he's going to have them all out by the end of May, and I think it's going to be sooner if he said that, because I know he likes to beat his deadlines, could we basically have them all we get in arms by the end of May or first week in June?
Well, 2 thoughts. One is, as I've said, we are going to continue growing our infrastructure. One of the reasons why I wanted you to meet Chaz Eby today is one of his jobs is to collect all of the proposals that we're getting and start looking to see what's the next phase of either expanding local health department operations that they already have, or possibly deploying additional sites. And so Chaz will be overseeing that, and he's getting organized around that.
Last thing's a real quick comment. I hope you'll really look at Asian centers, Hispanic centers, African-American churches, and get some vaccines out where the people that need them are. Well, like in Baltimore, you have 2 mass sites and they look like they're no more than 2 blocks apart, or maybe a little more than that, but not much. So that's just a comment. I hope you'll look at trying to get them around to where some of the people that aren't getting them live.
Right. No, that's a very good point. And we have been targeting centers like that. For example, MedStar has been doing Cherry Hill and Brooklyn. Curtis Bay has been going there. They're looking at Hispanic, like Iglesia Adventista, Tiempo de Gracias. LifeBridge is working at McCullough Homes. I could go down a list here. We're doing exactly that strategy. So you're right on the money. Thank you for that.
Well, thank you, and keep improving.
All right, thank you, Senator. Senator Washington.
Thank you, Mr. President, Chairman. Thank you, Acting Secretary. And again, we continue to move forward. Just a broad comment, I continue to share concern that Senator Eckert's people, Marylanders, are competing with Delawareans for vaccines, that the license plates, that her constituents are not getting access to that. Also with Prince George's County and even Baltimore City, when you're looking at who's getting the vaccines, are not coming from those jurisdictions. And I would encourage, and I'm glad that you've come up with the trust in transportation and technology, but I think we've well established that part of the trust is making sure that people are communicated with properly, that they have the transportation that they need, and that they are able to use the technology that is most accessible to them, like a phone, for example, in order to get a vaccine. I have just a broad question or a specific question about mobile vac sites. So you mentioned last week that you were going to stand up a couple of mobile vac sites. Would it make sense when as example, in Senator Eckert's area, that there are seniors that are not able to get to the CVS to set up a site there? Have you started that yet, and where are they?
I'm at the moment, General Burkhead is putting that together. We're expecting that to start any week now. She is targeting both the Eastern Shore, Western Maryland, and the urban areas. So that is part of her operations plan that was rolled out last Thursday.
Right. So, okay. So I think I thought it was happening this week. So you're saying that the mobile units will start to roll this time next Monday, but when we're on the call again.
If I could, Madam Senator, what I'd like to do is we'll follow up with the general and get a game plan with a schedule and whatever. Right. I don't want to get ahead of the general because I know she's working very hard and is very focused. So we'll get some information and bring that back.
Thank you. And now this is a broad question about vaccine distribution. We've been talking about getting shots in the right arms, and you've been allocating, giving us some reports on allocations. I appreciate that. So one change to your allocation chart that I think we would like to see is if the allocations, if you could also provide how much of that is going to a hospital. So for example, in Baltimore City, I believe that the allocations to hospital networks who serve, not just the city in which they reside. If we could just see what proportion are going to hospitals, I think that will help us. Also, just if that's cool, if we could do that.
If I may, Madam Senator, we do that every week, and it's online with our on the bulletin, and the bulletins. We actually this week we sent like a 225-page document for the 24 questions. Embedded in there, you'll see in the bulletins, it tells you week by week how much has gone to each hospital.
I appreciate that. If you could just shade in, just, for us, for our purposes, and for the public transparency, so we can, really see that on the chart. I don't think it would take much. And then my final is just a set of questions around really making more visible the vaccine distribution. In other words, there must be some human who's responsible for providing the vaccine updates in the governor's office. Who is that? Is there one person or one human whose job it is to do that?
We give you every day all the data that we give to the governor's office, we give to you through the Senate president and the two presiding officers. So every bit of data that we have, and the data that you're getting is straight out of the Immunet system.
So that's you. So you're the person who knows when the shipments of vaccines are coming,
Well, not me personally, but we have a team of people, and that we've put in place over the last many weeks that's managing the detailed supply chain.
Right.
So there are people tracking that. Yes, but the data that you're asking about, which is what has been administered, we have a 10-page document that we send out every morning, and that data comes from Immunet, and it's broken down by hospitals, local health departments, local jurisdictions, and it's sliced and diced many ways. So you're getting all of the data that the governor's office is getting and we're getting. It's all out there.
I got it. This is just about us, we're all in this, using this platform to make more transparent, not just to us, but to the public. And I guess what I'm interested in, I know I'm pivoting a little bit than what I usually ask you about, but I want to keep it interesting, but also just really get into that supply chain, which you're talking about. So I think it would be helpful, particularly as I believe Senator Rosapep talked about, that we're going to be having hundreds of thousands of more shipments coming in. So how early do we find out? Is it a day in advance, 3 days? Is there a truck? At some point the shipment's going to arrive. How many vaccines, and who knows? Is this one person who knows? How are they identified? Is it a single official? Is there a committee who's deciding the distribution? How does it really happen? Throughout, it's those kind of questions that, and they're all answerable. And just to finish with it, just when we've asked this in the past, it's been sort of vague, but I really think it's important for this process to be helpful both to you and for us, if we really know exactly what branch, who's providing this information, what trucks are coming in, how, is it an hour or 2 hours? Does somebody have an issue? Because why I raise that is that slowly there's that issue of unused doses might become an issue, people not showing up. So I think more we know about that critical path, that supply chain, I think the better.
We'd be delighted. We'll go back, we'll pull something together. There's a massive amount of information on how this works for this level of, as I said, we've built a theater scale operation, and we'd be glad to share that with you because it's actually quite impressive, and I think sharing it with you would be a pleasure.
And it would be good. And just one last is to include the private service providers, because, I'm starting to get texts from CVS. Some people are telling, some constituents are calling saying there's getting a text, and Giant is saying there's no available appointments within 10 miles of your location. And then, the University of Maryland is saying that they have. So, there's a lot of different messages going out there. So thank you. Thank you, Mr. President.
Thank you, Madam Senator.
Senator Lamb.
Thank you, Mr. President. Jake, if you can bring up that slide. We've been fielding a lot of questions from confused constituents as to where they can get vaccinated and in what category. I think a lot of this stems from the fact that there's different criteria that are being created by the local counties, and that the state has moved very quickly into 1C. We came together and put together just these basic scenarios, drawing some hypothetical folks, and to just demonstrate why there's so much confusion out there. you can look at this as a 55-year-old pastor, can't get in Worcester, can't get in Carroll, can only get pre-registered in Montgomery. And you can see all these cases where in some instances they can, in some instances they can't. And you can see why there's some confusion. There's a lot of confusion going on out there and why we're being contacted. So one, can you see why this is confusing, and what is the state doing to help clarify this confusion?
So early on, if you'll recall, about 8 or 10 weeks ago, there was a significant push from the local jurisdictions to have the ability to decide whether they wanted to be in 1B or 1C. And at the time when we, it started out, there was a lot of pressure to go to 1C. And then when we went to 1C, other counties said, well, we want to stay in 1B. So early on, we honored the request of the local jurisdictions to give them discretion within the framework of the 1A, B, and C.
But this runs counter to the fact that if you focus on 1B, you would be able to vaccinate more of 1B to a higher percentage before moving to 1C. I think it's convenient to be able to just throw this back to local health departments and say that this is their fault that they had asked for this, but it's generating a lot of confusion across the state. And I think it's still incumbent on the state Department of Health to be able to try to address some of this. My second question has to do with, there was a Gaucher poll that came out today that showed that there was little difference in vaccine hesitancy amongst Black and white Marylanders. However, when we go back to the data that's on your own website that's drawn from Immunet, white Marylanders are being vaccinated at a rate probably more than 3 times that of Black Marylanders. And so for the last couple weeks, both you and the governor have cited this to vaccine hesitancy. It sounds like just a few minutes ago, you kind of redirected this to now transportation and technology, because if it's vaccine hesitancy, some of the efforts that you've undertaken, for example, to send sound trucks into Prince George's County, I think is just woefully inadequate. It's like trying to give someone an umbrella in a hurricane to say, have at it and good luck. I think there needs to be a lot more that's done to address the true causes of why Black Marylanders are being vaccinated less than white Marylanders. And so what are you exactly doing besides sound trucks to be able to get at these limited populations?
Well, a couple thoughts. So one is the vaccine operation plan that was rolled out last week and will be gaining momentum over the next several weeks. But let me step back and make a couple of observations. As you look at the distribution, because we've been drilling into the data, the interesting thing we've noticed is that, the first doses by race, 59.8%, and this has been dropping, are white. And as Mr. Powell noted, we're seeing the African American numbers inching up. We've gone from about 14, 15%. We're getting close to 17%. What we're interested in analyzing right now is the 17.6 other, because what we're realizing, we've gone into the CRISP data, and the CRISP data actually has better information about race than the Immunet, because the Immunet is a one-time thing. Somebody signs up and they either say yes or no. What we're finding, and we haven't finished this analysis yet, but we think the 16.8 is even higher than that. However, it's not where it needs to be, so I don't want to suggest that that's going to solve the whole problem. But the interesting thing about this is that the white population in Maryland is about 58%, and the doses are about 59.8. So we're going to be taking a very hard look at that 17.6 to try and get a better understanding of what population is represented in that 17.6. Now, of course, this is the distribution of those who have received vaccine. It's not, it's not the total population. So I don't want to extrapolate it to the entire population. We've got clues here that we've got to continue to analyze.
So I appreciate that. I think from my perspective, we're going to week 13 now. We're still trying to figure out what the problem is as to why we can't get Black Marylanders and some of the minority groups vaccinated at the rate of white Marylanders. And, you know, I'm not hearing many answers here. I'm hearing really still trying to grasp at the problem, which has now shifted from hesitancy over to transportation technology. Last two questions. Number one, what role does Dr. Redfield have in the vaccine rollout? What role does Dr. Redfield have in relation to vaccines? Is he advising you or the department or just the governor?
He's advising the governor, and of course, as he advises the governor, we benefit from that advice.
So he's not directly in contact with you or the department and not advising the vaccine rollout. Is that correct?
Yeah, I'm not sure. I'm not sure where you're going with that, but he's advising.
Well, it's a simple question. Is he advising you?
He's advising the governor.
So he's not advising you. Okay. Last question then is, how are we going to measure success at the end of this when vaccine supply is more abundant? Who will be responsible if things go well or don't go well at that point?
Well, the buck stops with me, obviously.
Okay, so you will take full responsibility of this particularly when we have more vaccines present, to be able to ensure that all Marylanders have an equal opportunity to be vaccinated.
Senator Lamb, I'm a military officer. I've served this country for 26 years. I've been all over the world. The buck stops with me.
Okay.
Sounds good. Thank you, Mr. President. Back to
Thank you, Senator. All right, 13 weeks in, off we go. Appreciate your time, Mr. Acting Secretary. Thank you, members. We will see you next week for week 14, and stay safe. Thank you.
Thank you. Thank you, Mr. President.